So I am Jaclyn Evans, and this is VRI with Innova Health Systems. I've been in the field personally for about 15 years. I oversee the Sign Language Services Department for Innova Health Systems, which includes 22 staff interpreters. That's sign language. And then we have a number of spoken language interpreters that are staff as well. And we also have 6 schedulers that man a phone line for us to help coordinate our services and need for interpreters or whatever other needs we may have. We have a number of locations. We have about 16,000 employees. We're one of the largest employers in the area. The facilities that we cover include 5 hospitals, and then there's about 60 sites that are off of a hospital campus. So we can go to the next slide. Now on slide 4, it references our emergency departments, and that includes off-site and in hospitals. And then on slide 5, we have a list of our urgent care centers. That's just a step under what you would need in an emergency room. And then the next slide. This just lists some of our primary care locations. We're growing almost daily with this. And then we can go to slide 7. This lists specialties for adults and children. It's quite large, so you can kind of read it as you go along. Also on our website, which is referenced on the last slide, it gives our website address, which has information on all of the services that we provide, which are not all listed here. So then we can go to the next slide. So our kind of philosophy in reference to interpreter services is that we feel like in honoring ADA and referencing effective communication, that the only person that's really qualified to make that decision is the patient or their companion. We don't enforce that a patient has to use, first of all, they don't have to use an interpreter unless they want one. They don't have to use an in-person interpreter unless they want it, and they have the option for VRI if they would like that as well. We also offer a number of assistive devices for suppose like a lot of geriatric patients that may have a latent hearing loss. We have like a pocket talker, which is just a little box that they can wear to help amplify, and that works through hearing aids or just with earphones. So we can go to the next one. We do definitely have a requirement for VRI, only because of the size of all of our system with 5 hospitals alone. We sometimes we'll get multiple calls in an evening for more than one interpreter that's needed, so we heavily depend on having VRI as an immediate option until we can bring like a real in-person interpreter if that's what they'd like. Next slide. At Innova, we're trying to be a little progressive and a little innovative and kind of go outside of the box. We have actually hired 22 sign language interpreters, and they're all based on what is considered, it's called PRN status. and that means that it's work as needed. So they don't have guaranteed hours with us, and they don't guarantee us hours, but they are direct employees for the hospital. And this has enabled us as an institution to kind of be very selective in who we chose. And a lot of our PRN interpreters have an extensive medical background. Some are studying at different universities in the area. Actually, we have a scheduler that is studying audiology here. But a lot of them either have a lot of medical background, either through prior work experience, interpreting, and a lot of them are also codas, which I feel is important because when you're depending on staff to come pretty much, for the most part, in ideal times, with all the emergency visits and that kind of stuff, you need people that are a little more committed maybe than some other agency work that people might do. Another thing that we're doing that's, I think, a little bit progressive compared to some other hospitals is that we are trying to pilot our own VRI internally. And we've done this mostly through spoken language first. So the way that we've done this is we have a Spanish spoken interpreter that utilizes our VRI platform, and any facility or any hospital location can use one of our portable devices. We currently use NextTalk, but that's just a platform. But they can dial up the Spanish interpreter so that they can kind of be utilized in that capacity. We also have set up, I have VRI capabilities at my house, just so that in an outward extreme emergency, we have almost a third-tier backup to our staff interpreters, and then our VRI that we utilize, and then myself as a third level, so that we never end up in a situation where we don't have somebody for a patient or a companion. We can go to the next slide. There's obvious obstacles for VRI, which I think everybody knows that certain situations, especially in medicine, are not conducive. If a patient is restrained for any reason, like a car accident and they have to be on a backboard, if they're extremely tired, if they're in a lot of pain, the obvious limitations with visual impairments. And then I think another main concern is just if a 9/11 or some natural disaster happens, what do you do if you lose your electronic connections? So we can go to the next one. Some suggestions that I would offer. I want to preface this by saying I have not done VRI interpreting myself, so I will say that I'm speaking a little bit blind here, but more from the patient or the client standpoint. One thing that I would suggest is that somebody that's interested in doing medical VRI needs to take into consideration a few things. And that would be some kind of actual medical interpreting in person, just to give you some of the physicality and the setup of an environment so that you know what you're going to be encountering on a screen. I would also suggest strong importance in following continued education as far as medical terminology or the current practices or procedures, because they change so rapidly that you can find yourself outdated very quickly. Another thing is I would consider the kind of situations you're going to be utilized for. In our situation, most of them are extremely stressful. So you're dealing with emergency rooms, labor and delivery, sometimes a very, not exciting, but just a very busy atmosphere. And then I think compounded with that, just in my experience from seeing when you come in to relieve a VRI, that you're just in the middle of something and then just cut off and you have no idea, whether that person was okay or, it would be a little traumatic or stressful, I think, in my opinion, to be midstream interpreting a pretty intense situation, to have it cut off in an instant. And not that that's not okay, just I think you need to mentally prepare yourself for that. So then we can go to the last slide. And in closing, I just wanted to mention our mission, which is to improve the health of the diverse community that we serve through excellence in patient care, education, and research. And I feel like it would take way too long and is not really applicable to this. But if you visit our website, because Inova is a nonprofit organization, even though they are large and medical facilities, they are one of the largest donors in the community as far as funds and services. And so if there's anything that you have any questions, you're more than welcome to contact at the address that you see on the slide 13. And my email is on the second slide. So thank you.